Lampin and I were just talking about this to a group of pediatricians
Oh, were you?
yesterday or the day before, sometime this week. And they were like, there's so much conflicting information out there. Like, the WHO said you shouldn't wear masks when you're doing vigorous exercises. Why are we one of the only states that's mandating the mask thing? So I can comment a little bit about that.
Okay.
Like so many things with COVID, it's like imperfect information, but needing to take reasonable action. And I think that this is,
but yet people are able to find like whatever they need that's supporting their side,
of course.
So I wanted to start off though with the kids in COVID. And so basically, hi Rick.
Hello.
Hey, you guys are probably already killing it, right?
We're just chatting.
We're just chatting right at the moment.
I just want to make sure you all met. I'll just hang out and hide because I know you're awesome, Val.
Are you eating lunch?
I'm eating some raspberries, yeah.
What?
I was gonna say I love Rosie's background.
I know. Is it your office?
No, this is my home.
Oh my gosh, it's beautiful.
Yeah.
I love the natural light. It's just it's really
a little bright in here actually. It's like we oftentimes are like, whoa, but
well, it's giving you really good uplighting. So that's
thank you.
So you're doing well. So this all came about because Dr. Jay mentioned yesterday in her part of the press conference with the governor that we had a 2-month-old that had died. Do you know how many pediatric deaths we've had in the state of Michigan?
No, I don't know exactly how many there are. We haven't had any pediatric deaths in West Michigan. Right. The only other case that I know of that was a death was on the east side of the state. And that was a 5-year-old who I think may have died from the inflammatory syndrome related to COVID or something else, but that was actually several months ago. Yeah. So our fatality rate for children in Michigan is extremely, extremely, extremely low.
Right.
So.
And then that's one of the things that I'm also going to include in this is just the statistic that like, even though this is concerning for parents, the reality is less than 1% of children will die who get COVID will die. That's at least that's what I got from the CDC.
Yes, it's extremely, extremely low. And we try to pool numbers across different states to look at even the hospitalization rate for children. And depending on your year of influenza, it's like a fraction of what you would expect for hospitalization, even for children. So it's still very much something that we're not angsting about nearly as much as we are on the adult side.
Okay. All right, so we're going to start. Rick, do you want to hide yourself?
Yeah, I'll hide myself. Sorry. Here we go.
That's okay. I have to hide you. Right. Hide non-video. Okay. So basically what I want to do is like just make whatever you think it is that parents need to know about, like what's important for them to know about COVID in children. And if their child gets COVID, just so that we don't have this escalated fear, but yet at the same time, they're watching for it. So what's your advice for parents when it comes to their children and COVID?
Right. So still, over the past several months, as we've kind of marched through the COVID pandemic, and we've gotten more and more information about how severely ill children can get from COVID-19, and what the other side of that, how likely are they to recover from it? And as the months have gone on, we really have continued to get, for the most part, very reassuring information about children when they are affected with COVID. The vast majority of children who get COVID are still having very mild disease courses. Very few, relatively speaking, are being hospitalized. And we have very infrequent cases that children need to go to the intensive care unit, need maximal support. And luckily, deaths related to COVID for the pediatric audience remains extremely low. So it doesn't mean that children can't get COVID. I know there's been a fair amount of confusion about that over time as some medical literature has been reported. We know that children can get COVID just as an adult would. We're still learning about how children transmit COVID, if they transmit it as efficiently as our younger adults and older adults transmit it. So certainly I believe that COVID can be contracted by a child. So a child can just as easily get COVID as somebody else, but they're still not very likely to get severe disease that would require them to come to the hospital to stay. So that's, it's still a very reassuring message. Now, there's going to be the occasional child that for whatever reason, and we're still trying to learn about why this may be, the occasional child may get more severely ill with COVID and need medical attention. We know there are some risk factors for that may be the same ones as that we see in adults. So children who have underlying heart or lung disease, children who are markedly obese, uncontrolled diabetes, those are all things that we've seen be some risk factors for children getting more severe COVID. And then once in a while, we'll hear about an otherwise healthy child getting more severely ill. And we're still trying to understand that, to be honest. But
oh no.
Still, those reports are extremely small numbers. For the most part, if your child contracts COVID, it's going to be a mild disease and they will recover. So that's still a very promising message. Doesn't mean that we want to let up on any of our diligence about preventing the spread of COVID. We still have a huge portion of our population who is, and we have seen again and again that they're at higher risk for getting severe COVID-19. And we really want to continue to slow that spread, especially as we're heading into the season where we see more respiratory viruses being circulated, like influenza, RSV, all these other infections that can make you very sick. So we're really still trying to slow that spread of COVID so that our most at-risk people for severe disease don't get affected, especially not all at the same time, because we want to keep our hospitals open and at good capacity levels to take care of our communities.
And so what are some of the symptoms, like for the little ones, for those like under 5, that parents should look for with COVID?
Right. So even, you might have a child who comes down with a respiratory illness and you may not know if it is COVID. You may have a very concerning close exposure, like a parent or a sibling all living in the same house who have COVID. And so then if your little one becomes ill, you may think the first thing is COVID. And actually, many of us who aren't exposed to COVID, whenever we get a sniffle, we think, oh my goodness, is it COVID? So sometimes you have a little bit of a higher suspicion. Sometimes you just don't have a whole lot of information other than, my child's a little bit fussy, has a runny nose, might have a fever. So at the outset, you might not know. And so really, COVID, how we manage COVID in pediatrics is very similar to how we'd manage any other respiratory viral infection. We want to control their fever if they do develop a fever, and you want to do that with your pediatrician's guidance. And then you want to look and make sure that the child is not having any difficulty breathing. So fast breathing, pulling in the skin between their ribs, using their abdominal muscles to breathe, severe cough to the point that, that they can't catch a good breath. Those are all concerning signs, or a very fast breathing rate. Regardless of any infection, you want to seek medical advice and care if you have those more concerning respiratory signs and symptoms. The other thing that we always look out for in pediatrics, vomiting and diarrhea and not making good urine output, those are all signs that your child could be getting dehydrated and may need medical care. So whether or not you have COVID, really all of those same foundations of pediatric care still apply. And so I apply the same thing, whether or not you have COVID. It's really just the same old pediatric care.
Is there anything else about the kids and COVID, or easing parents' fears about their child dying from COVID, or anything that we didn't talk about that you wanted to add?
No, I don't think so. I think that, we need to be diligent during this respiratory viral season for, all of the different viruses that are, that could affect your child. And so I think, we all have heightened awareness and sensitivity right now. So continue to be diligent, and certainly use your pediatric office if you have concerns. Don't feel like you need to sit on a concern of yours, especially overnight. Our emergency rooms have good capacity. If you feel like there's things are going out of control, certainly seek out that medical care. Back in March and April, a lot of people were afraid to seek medical care because they didn't want to be sitting in an emergency room and potentially get exposed to something like COVID. But, we really have very good procedures in place for making waiting rooms as safe as possible. So I want people to feel assured that they can seek medical care if they do have concerns. And then in some cases, you and your doctor may decide that doing the test to confirm potential suspicions for COVID, that certainly can be done.
Okay, so let's move on to the whole mask situation.
Yes.
So let's talk about the importance of kids, first of all, just kids in general wearing masks.
Right. So with other viruses, and most notably some of our big years of influenza, for example, we'll just use that as a comparison. We know that children can be what we call a vector of an infection, meaning that they carry it and they can pass it along to others very efficiently. So this has been a huge debate for COVID-19, and this is actually part of the reason that schools were closed back in March when they were, because we used the analogy of what we knew about influenza, that children can really amplify the spread of a respiratory virus very quickly in a population, especially when they're in group childcare settings. So that would be daycares or your schools. And so, COVID-19, again, a lot of that information we're getting as children are going back to school, we're learning more and more about how efficiently they spread COVID-19. But until we get that information, we're really trying to use the best information that we have in the moment to make decisions about how to protect the community at large. And we know that if you wear a mask, you being an adult or being a child, if you wear a mask, your likelihood of spreading through the respiratory route a virus to people that you're in close proximity with goes down dramatically. It's not 100%, but it is a very easy measure to take to protect other people. So as a public health strategy, if we have a setting like a school or a sports playing field or a daycare center, and you can keep children in masks and also encourage good hand hygiene, that risk of spreading to others is going to go down. Now, we can't say exactly what percentage, but we have pretty good reports of different settings where masks have been incredibly important to limiting the spread of COVID-19. So this is really a community-based preventative measure to help slow the spread in a population.
And so when it comes to kids in sports, there are some sports that are saying, well, if you're on the sidelines, you have to wear your mask, but if you're playing, you don't. Some are saying you have to wear the mask the whole time you're playing, whether it's soccer or football or tennis, whatever it is. So what are your thoughts on kids playing sports wearing a mask compared to whether or not this is hindering their breathing? We've had some parents say that, my son played soccer last night with his mask on. He came home and he was like, he threw up. He was so sick. He wasn't, he didn't feel good. What are your thoughts on the masks in sports?
Yeah, so we this is a total like a new thing that we're experiencing right now. Having a pandemic in the modern era where people are trying to do things like play organized sports while wearing protective equipment like masks. And, if you look on social media, you can see all sorts of interesting memes and posts about people wearing masks and doing really rigorous activity. Obviously, those are just kind of sensationalized reports. And we really don't have a ton of information about the quote unquote safety of wearing a mask during rigorous exercise. However, as we're talking with other medical experts and kind of weighing the pros and cons of wearing masks during actual exercise or sports, the masks in general with breathable material are pretty comfortable, and kids can actually acclimate to wearing them pretty easily. And even in the past couple weeks, that our high school athletes and our youth athletes have been playing sports and wearing their masks, they've actually done remarkably well. And there are very few medical conditions where wearing a mask during exercise would be what we call contraindicated or not allowed. And things we think about like asthma or other underlying lung disease, really our experts are not thinking that that's a contraindication to wearing your mask, even when you're exercising. So, it's a moving target. We're getting a lot of new information and a lot of new recommendations. And the executive order is based on the best known evidence at this point in time. And with the hope that we can keep kids in school and keep sports going, we're trying to do everything that's absolutely possible to prevent outbreaks so that these things don't end up getting closed down. And this is one of the strategies that was decided upon. Now you could argue this a lot of different ways, but if you think about how we know that COVID-19 is spread, it's going to be when you are in close proximity. And potentially if you had a respiratory virus, if you were coughing in close proximity to another person, you could spread it. Or you could think if you're breathing really heavily, could you, if you were carrying the virus, could you spread it? And I would think that yes, if you were going to compare that to standing on the sideline, and when you're in close contact and huffing and puffing, that's probably going to be a riskier scenario. So I actually think it does make sense that if you're going to target the athletes, that actually having them wear the mask when they're in the most heavy contact and in breathing, using the most respiratory effort makes a whole lot of sense. So I can understand where that rationale came from. Again, we're still, these recommendations are being rolled out before we have the complete scientific evidence, but it doesn't mean we shouldn't do them, especially if it's not harmful.
Okay, that's all I had, unless there's something else you want to add about that.
No, I don't think so. I have plenty of personal anecdotes about watching my children play sports with masks, but I go to, these sports places and see all the kids running around wearing masks. They don't care. They just don't care. It's just, the one other thing I would say is that, your children will reflect the attitudes that the parents have about everything regarding, masks, personal hygiene, washing your hands. So if the parents can help normalize it and say, hey, this is just not a big deal. We'd love for you to be able to play soccer. This is how you're going to do it. I think that goes a long way. So I think that we as parents, can really do a lot of good by reinforcing this as something that we support, because we're thinking of the greater good and the big picture, which is like, we want people out and doing the things that they love and care about. So yeah.
It makes perfect sense though. I mean, I think you're right. I think that, the kid, it all depends on what the